NHA CCMA practice test. Question 1. According to OSHA and standard precautions, which item of personal protective equipment, PPE, must always be worn when performing venipuncture? Option A, goggles. Option B, N95 respirator. Option C, gloves. Option D, fluid-resistant gown. The correct answer is option C, gloves. Gloves are mandatory for all venipuncture procedures under standard precautions to protect against blood-borne pathogen exposure. Goggles and gowns are added when splashing is anticipated. An N95 is required only for airborne precautions, not routine phlebotomy. Question 2. According to current American Heart Association guidelines, which of the following blood pressure readings is classified as elevated? Option A, 118/76 mmHg. Option B, 124/78 mmHg. Option C, 132/84 mmHg. Option D, 142/92 mmHg. The correct answer is option B, 124/78 mmHg. AHA guidelines define elevated blood pressure as a systolic of 120 to 129 mm Hg with a diastolic less than 80 mm Hg. Normal is below 120/80. Stage 1 hypertension begins at 130/80, making 132/84 stage 1. Question 3. A patient performs a clean catch midstream urine specimen collection. What is the purpose of instructing the patient to void a small amount into the toilet first? Option A. To clear the urethra of external skin flora and contaminants. Option B. To reduce the total volume of the urine specimen. Option C. To test the flow rate of the urinary bladder. Option D. To ensure that the urine collected is from the kidneys only. The correct answer is option A. To clear the urethra of external skin flora and contaminants. The initial stream of urine flushes external urethral meatal flora and contaminants from the distal urethra. The midstream portion that follows is less likely to be contaminated, providing a more accurate culture result. Volume reduction is not a clinical goal. Question 4. A medical assistant is managing electronic health records, ER. Which of the following functions allows the electronic transfer of prescriptions directly to a pharmacy? Option A, practice management billing. Option B, CPOE, computerized provider order entry. Option C, automated clearinghouse transfer. Option D, patient portal messaging. The correct answer is option B, CPOE, computerized provider order entry. CPOE enables providers to electronically enter and transmit medication orders, including prescriptions, directly to pharmacies or hospital dispensing systems. This reduces transcription errors and improves medication safety compared to handwritten or verbally communicated prescriptions. Question 5. What type of healthcare setting specializes in providing care for patients who have a terminal illness and a life expectancy of 6 months or less? Option A, ambulatory care center. Option B, long-term care facility. Option C, hospice care. Option D, acute care hospital. The correct answer is option C, hospice care. Hospice care focuses on comfort and quality of life for terminally ill patients expected to live 6 months or less. It emphasizes palliative rather than curative treatment. Long-term care facilities provide extended nursing care but are not specific to end-of-life patients. Question 6. A medical assistant notes a prescription for a Schedule II controlled substance. Which of the following is a characteristic of Schedule II drugs? Option A. They have no accepted medical use in the United States. Option B. They have a high potential for abuse but are accepted for medical treatment. Option C. They can be refilled up to 5 times within a 6-month period via phone. Option D. They carry a very low risk of physical or psychological dependence. The correct answer is option B. They have a high potential for abuse but are accepted for medical treatment. Schedule II drugs have a high abuse potential with severe psychological or physical dependence risk, yet are accepted for medical use with strict prescribing controls. Schedule I drugs have no accepted medical use. Schedule II prescriptions cannot be called in by phone or refilled. Question 7. In a normal cardiac conduction cycle, which structure acts as the primary pacemaker of the heart? Option A atrioventricular, AV, node. Option B bundle of His. Option C sinoatrial, SA, node. Option D Purkinje fibers. The correct answer is option C. Sinoatrial, SA, node. The SA node, located in the right atrium, is the heart's primary pacemaker, generating impulses at 60 to 100 beats per minute under normal conditions. If the SA node fails, the AV node assumes pacing at 40 to 60 bpm. Purkinje fibers can pace at 20 to 40 bpm as a last resort. Question 8. Which of the following structures separates the thoracic cavity from the abdominal cavity? Option A pleural membrane. Option B diaphragm. Option C peritoneum. Option D intercostal muscles. The correct answer is option B. Diaphragm. The diaphragm is the dome-shaped skeletal muscle that physically divides the thoracic cavity above from the abdominal cavity below. It also serves as the primary muscle of respiration. The pleural membrane lines the lungs, and the peritoneum lines the abdominal organs. Question 9. According to CDC hand hygiene guidelines, what is the minimum duration for scrubbing hands with soap and water? Option A 10 seconds. Option B 20 seconds. Option C 45 seconds. Option D 60 seconds. The correct answer is option B. 20 seconds. The CDC recommends scrubbing all hand surfaces for a minimum of 20 seconds with soap and water to effectively reduce transient flora. This is approximately the time it takes to hum "Happy Birthday" twice. 10 seconds is insufficient to achieve adequate microbial reduction. Question 10. Which document provides instructions regarding a patient's preferences for medical treatments, such as mechanical ventilation or tube feeding, if they become incapacitated? Option A healthcare proxy. Option B informed consent form. Option C living will. Option D durable power of attorney for finances. The correct answer is option C. Living will. A living will is a legal advance directive that specifies a patient's wishes for life-sustaining treatments should they become unable to communicate. A healthcare proxy designates a person to make decisions, while a durable power of attorney for finances covers financial matters only. Question 11. Which insurance model requires patients to choose a primary care provider, PCP, and obtain referrals to see specialists? Option A Preferred Provider Organization, PPO. Option B Health Maintenance Organization, HMO. Option C Workers' Compensation. Option D Indemnity Plan. The correct answer is option B. Health Maintenance Organization, HMO. HMOs require members to select a PCP who coordinates all care and issues referrals to in-network specialists. PPOs allow direct access to specialists without referrals, offering more flexibility at higher cost. Question 12. A medical assistant is placing electrodes for a standard 12-lead electrocardiogram, EKG. Where should the electrode for lead V4 be positioned? Option A 4th intercostal space at the right sternal border. Option B 4th intercostal space at the left sternal border. Option C 5th intercostal space at the left midclavicular line. Option D 5th intercostal space at the left anterior axillary line. The correct answer is option C. 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space at the midclavicular line on the left side. V1 is at the 4th ICS right sternal border, and B2 is at the 4th ICS left sternal border. Accurate precordial lead placement is critical for detecting ischemia and infarction patterns. Question 13. When assisting a provider with a sterile surgical procedure, which action by the medical assistant constitutes a breach of the sterile field? Option A. Opening a sterile pack away from the body first. Option B. Keeping sterile gloved hands above waist level. Option C. Reaching across the sterile field to hand an instrument. Option D. Maintaining a 1-inch border around the sterile field. The correct answer is option C. Reaching across the sterile field to hand an instrument. Reaching across a sterile field introduces the risk of contamination from non-sterile clothing or body parts passing over sterile items. Sterile items should always be passed around rather than across the field to maintain integrity. Question 14. When a patient uses an adaptive mechanism of projecting their own unacceptable feelings onto another person, which defense mechanism is being demonstrated? Option A. Sublimation. Option B. Projection. Option C. Displacement. Option D. Rationalization. The correct answer is option B. Projection. Projection involves attributing one's own unacceptable thoughts or feelings to someone else. Displacement redirects emotion toward a substitute target, while sublimation channels unacceptable impulses into socially acceptable behaviors. Question 15. A medical assistant is documenting a laceration located on the anterior distal aspect of the forearm. Where is this injury located? Option A. On the front of the arm, near the wrist. Option B. On the back of the arm, near the elbow. Option C. On the side of the arm, near the armpit. Option D. On the front of the arm, near the shoulder. The correct answer is option A. On the front of the arm, near the wrist. Anterior means the front surface, and distal means farther from the point of attachment, toward the wrist. Together, anterior distal forearm refers to the front of the arm near the wrist. Proximal would indicate closer to the elbow. Question 16. When collecting a sputum specimen for culture, when is the best time to instruct the patient to collect the sample? Option A. Immediately before going to bed. Option B. Right after eating a heavy lunch. Option C. First thing in the morning before eating or drinking. Option D. Mid-afternoon following an exercise routine. The correct answer is option C. First thing in the morning before eating or drinking. Sputum is best collected upon awakening in the morning before eating, drinking, or oral hygiene, as respiratory secretions pool in the lower airways overnight. This yields the highest concentration of organisms in the most clinically representative specimen. Question 17. A medical assistant is checking the liquid controls for a CLIA waived gluconate device. How often should these quality control checks be performed according to manufacturer standards? Option A. Once every month. Option B. On days when patient tests are performed. Option C. Only when a new medical assistant is hired. Option D. Every time a new patient is brought in. The correct answer is option B. On days when patient tests are performed. Quality control for CLIA waived point-of-care devices must be run on each day that patient testing is performed, per manufacturer instructions and CLIA guidelines. This ensures the device is functioning accurately before any patient results are reported. Question 18. A patient is prescribed an enteric-coated medication. How should the medical assistant instruct the patient to take this medication? Option A. Crush the tablet and mix it with applesauce. Option B. Dissolve the tablet under the tongue. Option C. Swallow the tablet whole with a glass of water. Option D. Chew the tablet completely before swallowing. The correct answer is option C. Swallow the tablet whole with a glass of water. Enteric-coated tablets must be swallowed whole because the coating is designed to dissolve in the small intestine, not the stomach. Crushing or chewing destroys the coating, exposing the medication to gastric acid and potentially causing stomach irritation or drug inactivation. Question 19. A patient requires an intramuscular injection of a thick, oily medication. Which needle gauge is most appropriate for this administration? Option A 18G. Option B 21G. Option C 25G. Option D 27G. The correct answer is option A, 18G. An 18-gauge needle is appropriate for viscous or oily medications because the larger bore allows the thick fluid to flow without excessive resistance or prolonged injection time. Smaller gauges such as 25G or 27G are used for subcutaneous injections and thin solutions. Question 20. A medical assistant is participating in a patient-centered medical home, PCMH, model of care. What is a core concept of this healthcare delivery design? Option A fragmented specialty care focused on acute injuries. Option B comprehensive, team-based care centered around the patient. Option C minimizing communication between providers to reduce cost. Option D prioritizing diagnostic testing over preventative wellness. The correct answer is option B, comprehensive, team-based care centered around the patient. The PCMH model emphasizes comprehensive, coordinated, team-based primary care that is patient-centered and focused on continuity. It integrates preventive care, chronic disease management, and care coordination across all settings to improve outcomes and reduce fragmentation.